All right, strap in everybody, because today we are diving deep, deep into something that affects a wild number of us, thyroid nodules.
Yeah.
I bet you know somebody who's had one, maybe even yourself.
Uh-huh.
We've got this paper by Dr. Elizabeth Holt all about evaluating and managing these things. And then we've got this editorial from
Yes.
Dr. Praveen Ramachandra that has my eyebrows raised already with talk about some pretty cutting-edge advances in this field.
It is a rapidly changing field,
Yeah, that's what I like.
for sure.
We're going to break this all down so you walk away knowing what to watch for, what the tests actually mean, and what questions you should be asking your doc.
Absolutely.
But first, just a little shocker from the research.
Okay.
Nearly half of all adults have thyroid nodules.
It is incredibly common, and thankfully most are benign.
Ah.
But that's exactly why understanding those risk factors and how those nodules are evaluated is so crucial.
Okay, so let's play detective here.
Right.
What clues point to a higher risk of a nodule being something to worry about?
Oh, good question.
Give me the lowdown on the suspects.
Well, one of the biggest red flags is radiation exposure, especially during childhood.
Okay.
We're talking higher doses like those used decades ago to treat things like acne or enlarged thymus glands.
Wow.
It's a scary thought, but it significantly increases the risk of thyroid nodules and cancer developing later in life.
So we're still seeing the repercussions of those past practices.
Oh, absolutely.
That makes you think about historical events like Chernobyl, too.
Absolutely. The Chernobyl disaster, unfortunately, led to a noticeable increase in thyroid cancer,
Right.
particularly in children who were exposed to that fallout.
And speaking of radiation, I know this is on everyone's mind. What about dental x-rays?
Right.
Safe, or should we be worried?
That's a great question.
Yeah.
There is some evidence linking dental x-rays to a slightly higher risk, but the good news is that shielding and the shift to digital imaging have drastically reduced the exposure compared to years past.
Okay, that's a relief.
Yeah.
So radiation's on our radar.
hmm
What other clues are we looking for?
So family history plays a significant role. Having a close relative, especially a parent or sibling, who has had thyroid cancer, specifically types like familial non-medullary thyroid cancer, or FMNTC, or medullary thyroid cancer, MTC, increases your own risk.
So knowing your family tree matters, not just for holiday gatherings.
That's right.
Okay, what else?
So while iodine deficiency is a big risk factor globally, iodized salt has thankfully made it less common in the U.S.
Okay.
However, if you've lived in a region with iodine deficiency, it's still something worth noting.
Interesting.
Yeah.
So even geography plays a role.
Mhm.
Anything else popping up in the research?
So newer research is uncovering a potential connection between obesity and type 2 diabetes
Mm-hmm.
and a higher risk of thyroid cancer.
Okay.
This is a developing area, but it's certainly significant given the rising rates of these conditions.
Okay, so we've got our suspect list,
Mm.
radiation, family history, iodine deficiency,
Yeah.
and now potentially obesity and diabetes.
Yes.
Okay, so what happens when someone goes to the doctor with a thyroid nodule?
Sure.
What's the first step in this investigation?
So it all starts with a thorough history and physical exam.
Okay.
The doctor will ask about your symptoms, family history, any potential radiation exposure, and they'll physically examine your neck. They'll be feeling for nodules, checking for any signs of hypo or hyperthyroidism.
So far, so good.
Yeah.
But I imagine it doesn't stop there.
No, you're absolutely right.
Okay.
The next step is a blood test
Mm-hmm.
to check your TSH level, which stands for thyroid stimulating hormone.
Okay.
And this is surprisingly crucial.
Why is that? What makes the TSH level so important in this detective work?
So the TSH level tells us how well your thyroid is functioning.
Okay.
A normal or high TSH usually means it's working fine, and we move on to imaging tests like ultrasound.
Got it.
But a low TSH could mean that the nodule is overproducing thyroid hormone,
Oh.
and that kind of changes our approach a little bit.
Gotcha. So TSH guides the next steps.
Exactly.
So let's talk imaging. What's the go-to for getting a closer look at these nodules?
Ultrasound is really the gold standard.
Okay.
It's safe, it's painless, and it gives us this detailed information about the nodule's size, shape, internal characteristics, and even its position relative to other structures.
Wow.
It's much better at distinguishing between solid nodules and cysts compared to other imaging methods. Plus, it uses no radiation, which is always a plus.
Makes sense.
Yeah.
But what are you actually looking for on those ultrasound images? What makes a nodule suspicious?
So there are a few key things.
Okay.
Larger nodules tend to be more concerning, as are those with irregular or poorly defined borders.
Hmm.
We also look at echogenicity, which is how bright the nodule appears on the ultrasound.
Hmm.
Hypoechoic nodules, or the darker ones, are often more worrisome.
Okay.
Basically, we're looking for anything unusual that deviates from a normal, healthy thyroid gland.
So the ultrasound is like getting a fingerprint of the nodule, helping you decide if it warrants further investigation.
Exactly. And based on what we see, we use guidelines like the ATA guidelines from the American Thyroid Association or the TIRADS criteria
Right.
to kind of stratify the risk of cancer.
I've heard of those, but aren't they a bit different in their recommendations?
There are some nuances.
Okay.
Like the ATA guidelines generally recommend biopsies for slightly smaller nodules than TIRADS,
Okay.
but both agree on those red flags.
Gotcha.
Things like those hypoechoic nodules, irregular borders, calcifications, those are all kind of raising our suspicion.
Okay, so we've got the TSH blood test,
Right.
then ultrasound as our primary imaging tools.
Mm-hmm.
Is there ever a need for anything else?
Sometimes, especially if that TSH level is low,
Okay.
a thyroid scan might be ordered.
Hmm.
This uses a small amount of radioactive iodine or technetium to see how the nodule is functioning,
Yeah.
whether it's a hot nodule, which is producing excess hormone, or a cold one, which is a little bit more concerning.
Interesting.
Yeah.
Okay, so we've gathered clues from the patient's history, the physical exam, the blood tests, and the imaging.
Mm.
But the big question is, when do you move on to a biopsy?
So a biopsy isn't always necessary.
Okay.
The decision is really based on those ultrasound findings and the level of suspicion.
Right.
If we do recommend a biopsy, the most common procedure is a fine needle aspiration,
Mm-hmm.
or FNA.
FNA, that's where they use a thin needle to collect a sample of cells from the nodule, right?
That's exactly right.
Okay.
And it's usually done right in the doctor's office with ultrasound guidance for accuracy.
Okay.
It's a quick procedure, minimal discomfort, very similar to like getting blood drawn.
Mm-hmm. Okay. And then those cells are sent off to a pathologist to look for any signs of trouble.
Exactly. They analyze the cells and classify them using the Bethesda system.
Now, that's something I think needs a bit more explanation.
Okay.
What exactly is this Bethesda system? How does it help determine the next steps?
So it's essentially a ranking system
Okay.
to categorize those biopsy results based on the likelihood of cancer. The categories range from benign to malignant, but then there's also those tricky indeterminate categories.
Oh, yeah.
These fall into a gray area where we may need some additional testing to get a clearer picture.
The indeterminate category.
Yeah.
Sounds like a cliffhanger.
A little bit, right.
What happens when you're stuck in that gray area? Is it just a waiting game?
That's where things get really interesting.
Oh, good.
So molecular testing has revolutionized how we approach indeterminate nodules.
Right.
We can analyze the genetic makeup of those cells
Wow.
and get a much better understanding of their true risk.
Okay, now we're talking cutting edge.
Right.
It's like having a super-powered magnifying glass to zoom in on those indeterminate cells.
Exactly. Molecular testing helps us avoid unnecessary surgery for many patients,
Right.
while also pinpointing those who truly need it.
That's incredible.
Yeah.
But what about those cases where surgery is necessary?
Right.
What happens then?
So,
What should patients expect leading up to the big day?
well, before surgery, patients will have additional imaging, like an ultrasound or CT scan, to really see the extent of the nodule and check for any spread to the lymph nodes.
Okay.
Sometimes we also recommend lymph node mapping.
Lymph node mapping, what is that exactly?
So this involves injecting a special dye that travels to those lymph nodes.
Okay.
This helps the surgeon identify any nodes that might be affected by the cancer and need to be removed during surgery,
Gotcha.
ensuring a more precise and targeted approach.
So it's like giving the surgeon a roadmap to follow.
Precisely. And it's particularly important for medullary thyroid cancer,
Mhm.
which is more likely to involve those lymph nodes.
Okay. And I imagine choosing the right surgeon is crucial in these situations.
Absolutely.
Yeah.
Opting for a surgeon who specializes in thyroid surgery and has a high volume of cases is key.
Right.
Studies show that patients who go this route have better outcomes, fewer complications, and a lower risk of the cancer returning.
It makes sense. Expertise really matters.
It does.
All right. We've covered a lot in this first part of our deep dive.
Yeah.
We've explored risk factors, the initial evaluation, and even touched on the fascinating world of molecular testing.
We did.
But I'm dying to know more about the different types of thyroid cancer, the surgical process itself, and what life looks like after a diagnosis. So that's where we'll pick things up in part 2, so stay tuned.
Welcome back to our deep dive into thyroid nodules.
I'm ready to jump back in. Last time we left off talking about lymph node mapping and finding an experienced surgeon.
Right. And now that we've got that foundation, I think it's time to unpack the different types of thyroid cancer.
Yeah.
Because they're not all created equal.
That's what makes this so interesting. So
Right.
let's start with the most common culprit, papillary thyroid cancer.
Okay.
What sets it apart?
Well, for starters, it makes up about 80% of all cases.
Wow. Okay.
The good news is it tends to be slow-growing and often stays put in the thyroid gland.
Okay.
It also boasts a high cure rate, especially when we detect it early.
Okay, so not the most aggressive one out there.
Not usually.
But how do you actually identify it? What are the telltale signs?
So pathologists can identify papillary thyroid cancer under a microscope based on some unique features.
Okay.
The cells often have this ground glass nuclei and may form structures called papillae, which look like finger-like projections.
So it's like a microscopic fingerprint.
Exactly.
And I'm guessing those features, along with the size of the tumor and whether or not it's spread to the lymph nodes, that all helps to determine the stage of the cancer.
You're absolutely right.
Okay.
The stage tells us how advanced the cancer is.
Mm-hmm.
Luckily, early-stage papillary thyroid cancers can often be cured with surgery, either a lobectomy to remove just the affected lobe, or a total thyroidectomy if both sides are involved.
That's reassuring.
Yes.
What happens if it's, a little bit more advanced?
Sure.
Are there other options on the table?
So if it has spread beyond the thyroid, we may recommend additional treatments like radioactive iodine therapy or external beam radiation.
So even in those tougher cases, there's still a fighting chance.
Absolutely.
We've talked a lot about papillary thyroid cancer, but I know there are others out there.
Right.
What about follicular thyroid cancer?
Yeah.
How does that one compare?
So follicular thyroid cancer is a little less common,
Okay.
making up about 10% of cases.
Hmm.
It's also slow growing, but unlike papillary thyroid cancer, it's more likely to spread to distant sites, like the lungs or the bones.
So this one's got a bit more of a travel bug.
Unfortunately, yes.
Okay.
Because of that higher risk, even in those early stages, we usually recommend a total thyroidectomy,
Okay.
followed by radioactive iodine therapy.
So a more aggressive approach is needed to kind of catch any potential spread.
Exactly.
What other types are on our radar?
So two others worth mentioning are Hurley cell carcinoma
Okay.
and medullary thyroid cancer.
Those names ring a bell.
Yeah.
Didn't we touch on Hurley cells when we were talking about biopsies?
Exactly. They can sometimes show up on a biopsy, which can complicate the diagnosis since they're found in both benign and malignant conditions.
Right.
And because Hurley cell carcinoma tends to be more aggressive, a total thyroidectomy is usually the best course of action.
So not one to take lightly.
No.
Okay. What about medullary thyroid cancer? What makes it stand out from the crowd?
So medullary thyroid cancer originates from different cells within the thyroid, called C cells,
Okay.
which produce a hormone called calcitonin.
Wait a minute.
Yeah.
Calcitonin.
Uh-huh.
That sounds familiar.
Yeah.
Didn't you say it could be used as a tumor marker?
You've got a great memory.
Okay, great.
So elevated calcitonin levels can be a sign of medullary thyroid cancer, making it helpful for both diagnosis and monitoring.
So the same hormone that helps regulate calcium levels
Right.
can also be a clue in detecting cancer.
Exactly.
It's amazing how everything's connected.
It truly is.
It is. So in terms of treatment,
Yeah.
medullary thyroid cancer.
So for medullary thyroid cancer, it also typically involves a total thyroidectomy.
Okay.
But unlike the other types, radioactive iodine therapy isn't effective
Oh,
because these cancer cells don't absorb iodine in the same way.
so other weapons are needed in this fight.
Exactly. Depending on the stage, we might consider targeted therapies or chemotherapy.
Okay.
And this brings us back to molecular testing.
Yes.
It plays a critical role not only in evaluating those indeterminate nodules,
Right.
but also in guiding treatment decisions for all types of thyroid cancer.
It sounds like this molecular testing is a game changer on multiple levels.
It absolutely is.
Wow.
So this type of testing allows us to analyze the genetic makeup of those cancer cells
Mm-hmm.
and identify specific mutations that drive its growth.
Okay.
It's like looking under the hood to find the engine that's making the car go too fast.
And once you find that engine, you can target it with the right tools to slow it down.
Precisely. By understanding those molecular drivers, we can develop therapies that specifically block the pathways that fuel the cancer's growth.
Okay.
These targeted therapies are incredibly promising, especially for those advanced or aggressive cancers.
So personalized medicine at its finest.
Absolutely.
Are these targeted therapies available for all types of thyroid cancer?
Not yet.
Oh,
They're still relatively new and research is ongoing.
right.
However, we do have several targeted therapies that are approved for certain types with specific genetic mutations.
Okay.
So it's a rapidly evolving area with incredible potential.
That is exciting.
Yeah.
So what I'm hearing is that even though thyroid cancer can be complex,
Mm-hmm.
with all these different types and stages,
Right.
there's a lot of hope on the horizon thanks to these new advancements.
Absolutely. Early detection and personalized treatment strategies are making a real difference in outcomes for patients.
That's fantastic to hear.
Yes.
Anything else we should highlight before we move on?
Yes, I think it's just important to remember that overall, thyroid cancer has a very good prognosis, especially when caught early.
All right.
Regular checkups, knowing your family history, being mindful of any unusual symptoms in your neck can go a long way.
Great advice. Early detection is key, as with most cancers.
Absolutely.
But what about the emotional and psychological aspects of receiving a thyroid cancer diagnosis?
Right.
That's a whole other layer to consider.
Absolutely. It's a lot to process.
Yeah.
From the initial shock of the diagnosis to the stress of treatment, the ongoing fear of recurrence.
Right.
Having a strong support system is so crucial.
Absolutely. So where can people turn to for support? What are some good resources?
So talking to loved ones, connecting with other survivors, joining support groups, or seeking professional counseling
Right.
can make a huge difference.
Oh, yeah.
And remember, you're not alone on this journey.
So true. We've talked about the various treatments and their potential side effects, but what about the long-term implications? What does life look like after treatment for thyroid cancer?
That's an important question, and one that we'll delve into deeper in the final part of our deep dive.
Okay, perfect.
We'll explore what to expect during follow-up care, how to manage those potential side effects, and even how to navigate the emotional and psychological challenges that can sometimes arise.
Welcome back to our final part of this deep dive into thyroid nodules.
Yeah.
We've covered a lot of ground, but the journey's not over.
No, not at all.
Once that diagnosis is made,
Right.
today we're focusing on life after treatment for thyroid cancer and the importance of staying proactive with your health.
Absolutely.
Okay, so let's say someone's gone through surgery or other treatments for thyroid cancer.
Right.
What does long-term follow-up care look like? What's the game plan?
Well, regular follow-up appointments are key.
Okay.
These typically involve physical exams, blood tests to check your thyroid hormone levels, as well as look for thyroglobulin.
Hold on a second. Thyroglobulin, that rings a bell.
Yes.
Remind me what that is and why it's so important.
So thyroglobulin is a protein that's produced by the thyroid gland.
Okay.
After a total thyroidectomy, it should be undetectable.
Okay.
If those levels start to rise, it could signal that the cancer is coming back.
So it's like an early warning system.
Exactly. That's why those regular blood tests are so crucial.
Okay, so blood tests, physical exams, sometimes imaging.
Right.
What about the frequency of these follow-ups? Is it the same for everybody?
It's not necessarily the same for everyone. It really depends on the type and stage of the cancer, as well as individual risk factors.
Okay.
Your doctor will really personalize that follow-up plan based on your unique situation.
Makes sense. A tailored approach.
Yes.
Now, we've talked about needing thyroid hormone replacement medication after a total thyroidectomy.
Right.
What's the monitoring process like for that?
It's important to have your hormone levels checked regularly to make sure you're getting the right dose. We want to find that sweet spot where you're feeling your best without any signs of over or under replacement.
Right. So we're keeping an eye on both thyroid hormone levels and thyroglobulin through blood tests,
Yeah.
and then using imaging as needed.
Exactly.
Stay one step ahead. But let's be real, living with a cancer diagnosis,
Sure.
even one with a good prognosis, can be emotionally and mentally challenging.
Absolutely, it can.
Yeah?
There's that initial shock, the stress of treatment, the fear of recurrence. It's a lot to handle. Building that strong support system is vital.
What are some good resources for people who are feeling overwhelmed?
Well, you can lean on your loved ones, connect with other survivors,
Right.
find a support group, consider seeking professional counseling.
Okay.
Don't underestimate the power of sharing your experiences and seeking guidance from those who truly understand what you're going through.
Yeah, it's so important to remember you don't have to go through this alone.
No, not at all.
Now, we've talked about some potential side effects of treatments like radioactive iodine therapy.
Right.
Are there any long-term effects people should be aware of?
So the long-term effects really vary depending on the treatment.
Mm-hmm.
Radioactive iodine, while highly effective, can sometimes cause dry mouth taste changes or fatigue. And in some cases, it can also impact fertility.
Okay.
It's essential to have really honest discussions with your doctor about the potential risks and benefits of each treatment option.
So open communication and shared decision-making are key.
Exactly. And remember, if you experience any side effects, don't suffer in silence.
Yeah,
Reach out to your healthcare team. There are often ways to manage those side effects and really improve your quality of life.
absolutely. It's all about being proactive and advocating for your own well-being.
Exactly.
As we wrap up this deep dive,
Yeah.
what are the key takeaways you want our listeners to walk away with?
Well, firstly, thyroid nodules are incredibly common.
Right.
Most are benign, but if you do have one, get it checked out by your doctor. Early detection is critical.
Absolutely. Knowledge is power.
Absolutely. And thanks to advances in ultrasound and molecular testing, we can make much more informed decisions about who needs further investigation and what treatment is best.
And we've learned that thyroid cancer generally has a good prognosis,
Yes, it does.
especially when caught early. Plus, with these breakthroughs in targeted therapies, the outlook continues to improve.
It does.
And equally important is remembering that long-term follow-up care is essential, both from a medical and emotional perspective.
Couldn't agree more.
This deep dive has been incredibly insightful.
It has.
We've demystified thyroid nodules, explored the latest diagnostic tools and treatments, and even navigated those emotional aspects of this journey.
Absolutely.
So I'm hoping that you're walking away feeling empowered
So too.
and equipped to take charge of your thyroid health.
Exactly.
And don't forget, your healthcare providers are there to support you every step of the way. Until next time, keep asking questions, keep learning, and keep prioritizing your well-being.
Well said.